and also president of Cocolife.black. So thankful to be here. And the number one reason why I am a doula and being able to stand here before you today, certified as a doula, is because of this ministry here at Enon, because of the work and the vision of Pastor Waller and Sister Waller. And so I'm just so grateful for this opportunity. So I want to welcome you all here today to our first, and what I'm going to speak into existence, annual Black Maternal Health Summit.
Guide their words. Bless all who are listening, those in person and online, so that your name would get glory, that your creation will be blessed, and that generations to come will be able to say, because of what happened today, change has been made, justice has been invoked, and that your will would be done in each of our lives.
I want to
Bless us.
welcome everyone. As she mentioned, I'm Reverend Dr. Q English, and I'm the director for the Center for Faith-Based and Neighborhood Partnerships at the U.S. Department of Health and Human Services.
Morning to present a proclamation from Mayor Jim Kenney declaring today to be Maternal Health Care Day in the city of Philadelphia, and encouraging all residents to recognize the critical need for enhanced maternal care and the many efforts of those who make a valuable and essential impact on the quality of life for the people of Philadelphia in need of maternal health care.
So this morning I'd like to talk about saving lives. We're all talking about that today. And we know that that is a very pressing and issue that has unfortunately plagued our communities for way too long. It is time for us to transform maternal health care in America in what I call the maternotoxic zones. Let me explain a little bit more. So as the Reverend Dr. Q just said, I am a midwife, and I've been a midwife for a long, long time. I trained in London, which is why I speak like this. And I've been in the United States for 32 years at this point. I started midwifery with just stars in my eyes and just was so excited to be able to support mothers and families bringing life. When I got to the States, I expected to continue doing exactly that, only to find out, oh, it was quite different. One of the most
And while I serve in the 192nd, I also have the privilege of being the co-chair of the Women's Health Caucus for the Pennsylvania General Assembly in the Democratic House of Representatives. And I know we're going to get into this conversation, but what really brought me to this discussion was being a Black woman, one of 10 up in the General Assembly, and recognizing that we have a quiet storm pretty much happening that wasn't at the top priority of our conversations, and that being maternal mortality and infant mortality, especially because of the disproportional rates as it relates to birthing people that are from the Black African diaspora. So that's what brought me to the conversation, and looking forward to today's discussion.
Good morning. My name is Clarence Spazart, and I work for Albert Einstein Hospital. I am the co-facilitator for Parents Group, a dad's group called Dad Lab. We meet virtually currently, but I'm glad to be here so the dads are representative in this discussion. So thank you.
Doesn't have a child. Once you say maternal, and you're talking about our child, you invited me in. Our slogan from 2020 until now is, I am having a baby too. Not only am I president CEO, I'm also a postpartum doulos. A doula is a woman that works in the field. A doulos is the male version of a doula. This is us. These are some of the things that we do. We have a Fathers Club. We also have a Parent Academy. We have a Fathers and Young Men's Conference. We do the annual Daddy and Daughter Dance here in Philadelphia.
We have too much work to do to not feed into ourselves. So that's what I'm going to leave you with.